Hello everyone, it's Tim and I'm back once again with yet another video. I'm going to try to make them as quick as possible from now on. So I already have the arrows in place and the names of the deficiencies in place. This morning we're using the beautiful young Kylie Jenner, who is only 18 years old, and it is her age being the reason to why I'm using her today. I often get asked if the signs of deficiencies in which I speak about are nothing more than the normal process of aging. Uh, so today I picked a teenager with under eye wrinkles to show you that it simply is not. Um, so we're going to go on. I'm not bashing this beautiful young lady, and she is beautiful. You're all beautiful. You're all born beautiful, miracles of life. You will be a beautiful miracle of life until your time here is done, each and every one of you. I just don't want anybody to think that I'm picking apart these people when I do these videos. Anyway, we're going to go clockwise starting from the copper arsenite and go all the way around. So you see the arrow following going to the copper arsenite uh, indication, and you can look at the inside corner of her eyes and you will see a white triangle or boomerang that kind of follows the contour of where her upper and lower eyelid meet. This is a copper arsenite deficiency. I'm going to put these all together in the end, but I'm just going to go through them right quickly right now for now. Calcium fluoride, you can look and you can see multiple under eye lines or folds, wrinkles, whatever you'd like to call them. Calcium fluoride is responsible for the elasticity of connective tissue. Um, 18-year-olds, teenagers should not have wrinkles under their eyes. She does. This is because she's deficient in calcium fluoride. Moving upward, potassium phosphate. This is a little hard, going to be a little harder for you guys to see because she has very long eyelashes. But at the outside corner of her eye, there is a very sharp and deep indent. This is the greatest indicator of a potassium phosphate deficiency. I'll talk more about potassium phosphate in a moment. Um, Calcium phosphate, look at the upper eyelids. They're dark. They're not red. It's not vascular convulsions. There's a darkness, making it brown, black, almost bluish, that encompasses her entire upper eyelids, much darker than the rest of her skin. This is calcium phosphate. Moving forward, we go to zinc chloride, and you look at the vermilion line, which is the line that follows the contour of your upper lip. Hers is white. We've talked about this just recently, and I did another video or a photo to show the indications of a zinc chloride deficiency. Um, she has it quite strongly. Now, there's two issues that come up when I look at her photo. I would be highly surprised if Kylie here did not suffer from bouts of depression or anxiety. And the reason for this is that the deficiency of potassium phosphate, calcium phosphate, copper arsenite, and even zinc chloride uh, all correlate to serotonin issues or imbalances, whether it be from the serotonin receptors or lack of production. I really, really would be surprised if she did not have some form of behavioral issue or mental health issue uh, based upon her deficiencies. The other one is, and I'm actually going to have to remove the calcium fluoride lines from here. Here we go. And you see right below her right eye that she has some cystic acne going on. Zinc chloride is as effective or even more effective in many cases than minocycline, the most common prescription drug, which is an antibiotic intended to destroy the P bacteria, or sorry, it's antibacterial, intended to destroy the P bacteria and prevent cystic acne. Very hard on the stomach. If it's ever recommended to you, don't take it. It'll burn up your stomach and you'll wind up with leaky gut in a hurry. Um, but the zinc chloride deficiency correlates perfectly to the cystic acne that's beginning to present itself. There's some also hidden on her forehead that's hidden behind those lines, but I'm not going to tear this all apart. Um, I don't follow celebrities, so I don't know if her behavior's been in the news or not, but I would expect her to have some behavioral issues. Don't be too hard on her, folks, because it's not that she's a spoiled brat. It's that she's, and I don't know if she is. I hate even saying it that way. I just know that's the way that many haters think. Potassium phosphate, calcium fluoride, very, very particularly copper arsenide, another component of gray matter in the brain, all tell me that this young lady definitely has behavioral issues. I suspect it would likely be anxiety or depression. Uh, the zinc can be correlated a bit to the depression as well, because there are some correlations in how zinc proteins are used in with the neurotransmitters. But specifically to the acne, I think that would clear it up in a heartbeat. But I'd also like you all to know that these calcium fluoride uh, indicators, the lines under her eyes, uh, because of her age and her youth, they have not been there very long. Or I suspect that they have not been there very long. I'm sure they haven't been there for an entire 18 years. So I believe that supplementation in her case would most likely resolve that and remove those lines as the elasticity of tissues comes back and her skin can once again stretch and level itself out. Anyway, that's all for today, folks. Um, See you next time. Bye-bye.